Now, pharmaceutical companies are mostly interested in clinical trials, but it's really important also to have appropriate cognitive endpoints for neurologic diseases that can be used for all ages and across different clinical trials so that they can be compared to see whether one treatment might be more effective than another. If you use different data elements, you may not be able to compare one trial with another or a natural history study with a clinical trial. So they're very important for getting consistent and reliable cognitive data that can serve as an endpoint in diseases that have cognitive decline or neurological problems. So among the lysosomal diseases in particular, most of the mucopolysaccharidoses called MPS diseases, MPS type 1, Hurler syndrome, and the more attenuated Hurler-Scheie syndrome, MPS 2, Hunter syndrome, and particularly MPS 3, Sanfilippo syndrome, are diseases that have cognitive impairment. And in fact, Sanfilippo syndrome is a disease that is most like Alzheimer's or other neurodegenerative diseases of adulthood, because the children have a complete neurologic disease that it results in a downhill course over time and ultimately death from the neurological complications. So this is a true dementia of childhood. Just like Alzheimer's is a dementia that's seen in adults, this is a dementia that's seen in childhood. In order to measure outcomes in that disease, you particularly need to have consistent measures that are administered by testers who are familiar with the disease, who are familiar with the test, and who are able to handle the very abnormal behavior that these children have. And so it's a very big challenge to have cognitive endpoints in this disease, but it's the only way to measure the outcome of any clinical trial. So that's one disease. Other diseases that might need such protocols are metachromatic leukodystrophy, adrenoleukodystrophy, which is not a lysosomal disease, but it is a peroxisomal disease. Other diseases that affect the brain. I mean, I would say there are mitochondrial diseases, there are a number of other rare diseases that require this sort of approach of a rigorous, consistent protocol of tests that will be sensitive to change with treatment and change that is the result of disease as well in a natural history study.